USMLE Question 1. A 2-year-old child presents with genu varum bullogs, delayed motor development and weakness. The child is exclusively breastfed and has limited sun exposure. Laboratory studies reveal low serum calcium, low phosphate, and high alkaline phosphatase. The mother has a history of poor dietary intake of vitamin D. Which of the following is the most likely diagnosis, and what is the first-line treatment for this condition? A. Osteoporosis, calcium supplementation. B. Osteomalacia, vitamin D supplementation. C. Rickets, vitamin D supplementation. D. Paget disease, bisphosphonate therapy. E. Hyperparathyroidism, parathyroidectomy. Answer: Rickets, vitamin D supplementation. Explanation: this child's symptoms of genu varum, bullogs, delayed motor development, and weakness, along with laboratory findings of hypocalcemia, hypophosphatemia, and increased alkaline phosphatase, suggest rickets. Rickets is caused by vitamin D deficiency, leading to impaired calcium and phosphate absorption, resulting in defective mineralization of the bone matrix. Vitamin D supplementation is the first-line treatment for this condition, especially in breastfed infants who are not receiving adequate sun exposure or dietary vitamin D. USMLE Question 2. A 45-year-old woman with a history of sarcoidosis presents with fatigue, nausea, vomiting, and constipation. Laboratory tests reveal hypercalcemia, hypercalciuria, and increased serum 1,25-OH2D3 styrol levels. She also has elevated serum angiotensin-converting enzyme ACE levels. What is the most likely cause of her hypercalcemia? A. Primary hyperparathyroidism. B. Malignancy-associated hypercalcemia. C. Vitamin D intoxication. D. Granulomatous disease, E. Sarcoidosis. E. Chronic kidney disease. Answer: D. Granulomatous disease, sarcoidosis. Explanation: this patient's hypercalcemia, along with elevated 125-OH2D3 levels, is most commonly seen in granulomatous diseases such as sarcoidosis. Macrophages in granulomas can activate vitamin D locally, leading to increased intestinal calcium absorption and hypercalcemia. This is a common finding in sarcoidosis, and treatment involves managing the underlying disease and sometimes corticosteroids. USMLE Question 3. A 30-year-old man presents with fatigue, muscle weakness, and bone pain. He reports having limited sun exposure due to working indoors. He has a low calcium diet and a history of malabsorption. Physical exam reveals bone tenderness and muscle cramps. What is the most likely diagnosis, and what is the first-line treatment? A. Osteoporosis, bisphosphonate therapy. B. Osteomalacia, calcium and vitamin D supplementation. C. Rickets, vitamin D supplementation. D. Hyperparathyroidism, calcium supplementation. E. Multiple myeloma, chemotherapy. Answer B. Osteomalacia, calcium and vitamin D supplementation. Explanation: this patient's symptoms of muscle weakness, bone pain, bone tenderness, and muscle cramps, along with his poor diet and history of malabsorption, suggest osteomalacia, which is caused by vitamin D deficiency in adults. Osteomalacia results from impaired mineralization of bone due to defective calcium and phosphate absorption. Vitamin D and calcium supplementation is the first-line treatment. USMLE Question 4. A 60-year-old man with a history of granulomatous disease presents with nausea, vomiting, and fatigue. His laboratory results show elevated calcium levels, hypercalciuria, and increased levels of 125-OH2D3. He is not taking any vitamin D supplements. Which of the following is the most likely cause of his symptoms? A. Primary hyperparathyroidism. B. Vitamin D toxicity. C. Granulomatous disease, E. Sarcoidosis. D. Chronic kidney disease, E. Multiple myeloma. Answer C. Granulomatous disease, e.g. sarcoidosis. Explanation: this patient's elevated levels of 125-OH23 and hypercalcemia in the setting of a granulomatous disease, e.g. sarcoidosis, are indicative of increased conversion of vitamin D to its active form by macrophages in the granulomas. This leads to excess calcium absorption from the intestines, causing hypercalcemia. The treatment of granulomatous disease may involve steroids to reduce inflammation and granuloma formation.